Hi, and welcome back. This is season 3. Very exciting. We've got 2 seasons in of the State of Healthcare podcast. This season, we're actually delving into what I consider the conditions nobody talks about. So if you haven't heard a lot of we never really researched or studied the female body, yes, we are definitely delving into that. That is a hot topic. Women's healthcare has been pushed aside for far, far too long. But we're not just going to touch on that. We haven't forgotten about the men in the world either. But we're going to be hitting topics that people like to steer away from. And I'm excited to hear that there's actually a lot more going on in these areas. But knowledge is power. So again, like in everything that we talk about, you need to fight for your healthcare. Knowledge is power. So you're going to hear about conditions and maybe things that you might have had symptoms on and you've been afraid to ask about. So that's what we're going to be exploring. So welcome to season 3. Yes, we have not really studied the female body, but we're going to be hearing about a bunch of things. So come along with us on this journey. Hi, and welcome back. We are in season 3 already of the State of Healthcare podcast, and I'm kind of excited. As some things throughout the last couple of seasons we've hinted at about the importance of like women taking care of their healthcare. Not that we may just tease ahead, we might bring in a little bit of men's stuff on this season, but I am here today actually with Kimberly, who is a physical therapist. If you can't tell, I favor physical therapists, but she specializes in women's health and pelvic floor therapy. So I'm going to let her introduce herself.
Yeah. Hi, I'm Kimberly. I recently graduated from AT Still University in the summer last year, and now just starting out in outpatient sports medicine / also pelvic health as well.
Well, so my question is, what made you choose that specialization?
For the pelvic health specifically, yeah. So I was in PT school, and I had a classmate who was a tech at a pelvic health clinic, and then I also had 2 other professors who also did pelvic health kind of like as a side job. And then I was like, well, I know nothing about pelvic health, like what is this, right? And so when it was time for like to figure out what I wanted to do for clinical rotations, right? So then I was like, hey, like let's try pelvic health and see, I don't know anything, maybe I can learn. If I don't like it, then I know.
Yeah.
And so I ended up doing a 10-week clinical rotation at a all women's clinic in Arizona. And it wasn't until like halfway when I started to really feel like I related to a lot of these patients, because like having my own like pelvic health problems too, I was like, wait a minute, like I actually understand how you feel. And so like by the end of the clinical rotation, I was like, whoa, like this is actually huge. Like I didn't know pelvic floor existed. I didn't know what it was, like how it can benefit you. And so I guess like my biggest takeaway from doing that clinical rotation was like both men and women don't have to like live such horrible lives with having like their pelvic floor like impacting them in that way. And so for me, the reason why like I wanted to do more like pelvic health outside, now that I'm like licensed as a physical therapist, I wanted to like really empower both men and women that like we got to take charge of your life and you don't have to live this way type of thing. So
Okay.
yeah.
Well, so a couple questions coming from that. And if what was your journey then with your own pelvic floor? Did you get to be treated in that, or like how did, because I guess for me,
Yeah.
and at some point I'll probably launch on a feminist soapbox in a minute, but like I guess if you feel comfortable, if not, you could just also share some of the things that you learned. But what was your experience going through?
Yeah, so in doing my clinical rotation there, I saw a lot of women that were my age, and they were all having pain with like cervical examinations or like with intimate type of stuff. And then so that's like what the exact symptoms that I was experiencing too. And so for me, it was like, because I had my mentors there help guiding me and like teaching me things, I learned like a lot on like how to treat that and like what they can do for me too. So it's like both like a learning experience plus like a treating process too.
Okay.
Yeah.
I don't, she may have been one of your professors. I think Doc G or whatever. I follow her on Instagram, and she is pregnant now. She's a big CrossFit
Yeah.
physical therapist and she's pregnant. And she just did a post the other day about the importance of actually
Oh yeah,
starting with,
yeah,
with a pelvic floor therapist
yeah,
because she wants to continue lifting. She wants to
yeah.
continue doing all these things. And she says she goes to doctors and they're very conservative, like what she can do. And she's frustrated. But she said, like, especially OBGYNs
Yeah.
get sued a lot, so they have to be conservative.
Right.
So she was emphasizing why it's important to actually work with a pelvic floor therapist
Yeah.
who knows more about it and that
Yeah.
can help you on that journey.
Yeah.
And again, it's ironic because again, like I tend to be more outpatient and I think she's more of an outpatient, like CrossFit type therapist. So it's always nice to have someone else in our field who also then specializes in that area. So she did a really cool post over there.
Yep. I've been seeing all of her really cool posts. So I know exactly what you're talking about. Yeah.
So I think it's good that
Yeah.
PTs promote it too, just because again, nothing personal. It's not my area of specialty, but I appreciate that you guys are out there. So I guess my thing is like, what kind of conditions or things could you say that you would treat? Like, I know obviously pain with examinations. I'm assuming for women, there's like also pain with sex.
Yeah.
I'm assuming like bladder stuff, things like that. So what kind of conditions?
So that's a very loaded question.
Right.
But which is a good question to ask because a lot of people are like, oh, like I didn't know I can be treated for that for pelvic floor. So I guess to start with, there's a lot of medical diagnoses, right? There's endometriosis, there's urinary incontinence, there's constipation, pelvic pain with intimacy, all so many medical diagnoses out there. How I kind of like from my standpoint, I try to like break it down into, do you have pelvic pain or do you have pelvic weakness type of thing? Like trying to, because there's so many things out there, but at the end of the day, like the pelvic floor examinations and treatments are targeting the same thing, if that kind of makes sense. So I don't get overwhelmed with that. Obviously, like with some like specific conditions like stress urinary incontinence versus like pelvic pain during intimacy, those treatments look a little bit different, but we're still dealing with the same thing, which is pelvic floor. Does that kind of make sense?
So it's figuring out what's going on in that pelvic floor.
Yeah.
And I guess so for the average person, break down like what happens. Like why does this happen to so many people? Like why is this a thing?
Yeah. Yeah, so I'll start with, like why do we care with pelvic floor? What does it do for us, right? So it's responsible for our bowel, bladder, and sexual functions. And most of the times, right, I narrow it down into two categories as to why we would have like pelvic floor dysfunction. So like in one category, because pelvic floor are muscles, right? They should work like muscles anywhere else on our body, meaning that they should be able to contract, relax, and lengthen. So let's say like if I'm doing bicep curls, so like my biceps are contracting. If I'm resting my arm on my lap, then my biceps are relaxed. And then if I'm straightening my arm, then my biceps are lengthening, right? So like if we take that same concept and we apply it to the pelvic floor, and that's exactly what a muscle should do, right? If we're just looking at the muscle standpoint, like physiologically.
Right.
But then when things start to become awry is when, okay, like what is the current state of the pelvic floor doing right now? And so I usually break it down to two categories for patients where in one category, pelvic floor muscles can be weak or underactive. So like the medical term would be like hypotonic. Right. So these people who have this kind of pelvic floor basically essentially have weakness and they can't like have that strong ability to contract and then relax, lengthen, go through that full range of motion, right? So in this category, I see a lot in postpartum, a lot of women and men who have pelvic floor weakness, they have urinary incontinence, pelvic organ prolapse, things like that. So that's on one end of the spectrum. Another end is that we have an overactive pelvic floor. So a medical term is called hypertonic. And so essentially these muscles are working overtime and they don't know how to relax. They don't know how to go through that whole range of motion. So in this category, people tend to have a lot of pain during intimacy, things like that. So those are two big extremes, right? So we can be anywhere along the spectrum,
Mm-hmm.
but as long as we don't have any symptoms. But when we do start having symptoms, then yeah, like I would care about why, like what is our current state of the
Mm-hmm.
pelvic floor, and so that's where like the internal pelvic floor examination becomes super helpful. And then
Mm-hmm.
like from that, like the findings, then we can use that to kind of like create a more individualized plan, like
Okay.
this, what would be most helpful for you type of thing. Because they look a little bit different too.
So when you perform that, and again, for patients, I think
Yeah.
sometimes what comes with this area is probably a lot of embarrassment, I would
Yeah.
assume.
Yeah.
People like, I think the hardest part for me, like patient, because I actually had to go through and see like a gynecological pain specialist
Yep.
and I had all those years of like my own traumas of things, but I think it's just admitting that there's a thing
Yeah. Yeah.
and then like having someone go in there
Yeah.
and
It's
do an
very,
internal
yeah,
exam,
it's
right?
very vulnerable like that
Mhm.
for being in an examination and like,
Mhm.
but I think just meeting with the right provider and like getting a feel, because like for
Uh-huh.
me, I always give patients the option, like I let them know this is what the internal pelvic floor examination will look like. And
Mhm.
I give them a consent form to read that lays out this is exactly what I'm gonna do during the examination, get their double confirmation.
Uh-huh.
And I'm not here to like peer pressure them at all to go through with the
Mhm.
examination, because I've had some people who are like, what? Like that's too intimate. I don't want to do
Right.
it. And that's okay. We can do
Mhm.
other things.
Mhm.
So I always want to make sure that like they feel safe and secure first, and like
Right.
they're getting to know me and like vice versa. And
Mhm.
then maybe they're not prepared for that day. Maybe
Mhm.
they want to like kind of sit with that for a while, and then
Mhm.
later like on another visit we could try the examination, but it's not like I'm not trying to pressure them at all.
Mhm.
Yeah, so
Well, and I think that's the hardest part, again, because sometimes some like physical therapy, right? And then
yeah,
they're like, whoa, whoa, whoa.
yeah,
But it's also interesting when you talk about because everyone always, I think, pictures where they had just have to go in and do Kegels, right? Like, I'm going
right.
for pelvic floor therapy, I'm gonna do Kegels. It's also interesting in the world of
Yes,
aerialists
yeah,
because a lot of times aerialists tend to be overactive
oh yeah,
pelvic floor, which is
yeah,
kind of what I was reading, is
mhm,
that they're so busy, like always like
yeah,
down
engaging,
there
yep,
that
mhm,
they're actually and then they're doing Kegels and doing all the things
yeah,
and they're just making it worse, to be honest. So
yes,
everyone just assumes like, oh, I have a
yeah,
pelvic floor issue, I'll just stay at home
no.
and do Kegels.
Yeah, so that's a myth, right?
Yes.
So Kegels is like another fancy word for saying pelvic floor contraction. It's
Hmm.
strengthening the pelvic floor, but
Hmm.
not everyone needs Kegels, or like, in other words,
Hmm.
like Kegels isn't appropriate for everyone. So
Hmm.
that's why another benefit to having that examination is to see
What
like
actually is going on in there.
exactly.
Hmm.
Yeah. Yeah.
Well, and it's almost like your bicep analogy, right? So if I've got an overactive bicep or if
Yeah.
I'm just so tight,
Yeah.
and if I just sit home and curl,
Yeah.
I'm just going to make the muscle angrier.
Exactly.
And then I'm going to be shorter and shorter in
You'd
my
be like
range.
Popeyes.
Yeah, and then I'll just be here and I won't have a functional arm and it'll suck. But
Yeah.
yeah, so that's the kind of analogy. So I
Yeah.
think people um I feel like pelvic floor therapy is growing, right? I feel like there's starting to become some more openness about that, especially whatever opinions on politics or whatever, but I think more things are coming out for research for women and just even starting to address it. And even for men, like I have
Yeah.
some that I treat who have also see
Mhm.
pelvic floor therapists,
Yeah.
and then I work with them on other things.
Yeah. Yes.
So,
Yeah.
so what is your like your biggest advice or even just some of the main questions you get or like how would like things that you would tell people like
Yeah. I guess one
Mhm.
advice that I would give to everyone, right, is if you're not sure,
Mhm.
still go see a pelvic floor therapist just to
Mhm.
even see like are you a candidate for pelvic floor physical therapy. If you're not,
Mhm.
then you can just move on with your life, or and seek other providers for
Mhm.
help. But I think because, like you said, it is growing in terms of like pelvic floor becoming more popular. It's all
Mhm.
over like social media now and like
Mhm.
on Instagram and TikTok and all that stuff. A lot of that, some of my patients learned what pelvic floor is through that way.
Mhm.
But there's still so much of information that's not on social media, right? So
Mhm.
there's like bits and pieces, but it's
Right.
like I just still don't really understand.
Mhm.
And so I think just my recommendation is to go see a pelvic floor therapist and be more informed,
Mhm.
so that way they can have like a better understanding, like, oh, okay, like I get it now. Like this
Mhm.
is how it can be beneficial to me if I'm appropriate type of
Right.
thing. Yeah.
Well, and I think also like you probably battle. So in general, with physical therapy, I feel like a big hunk of our job is education,
Yes.
right? So you get people, they're usually in pain and they don't know what's happening to them and they're frustrated and they've gone probably possibly even years, especially pelvic floor wise. Usually those like someone who hurts their ankle or their back, usually they're more likely to be like, oh, I'm coming to physical therapy.
Right.
Whereas someone else like that, I think sometimes thinks they just have to suffer.
Yeah, yeah. That is a huge problem that I see now that you mention it. I've seen a lot of different age groups. So like I'll typically see people that are my age, right? They have very acute conditions and then they think, oh, like I think I'm okay, like I don't really need much help. But the ones that I see that truly sees the value in pelvic floor physical therapy are going to be the older women or men who have had this chronic issue for years and they're like trying to figure out, like how can I get some help there? And so I tend to find like those are the ones that are the ones that are more consistent. They are showing up for their physical therapy because they're desperate for that help, right? To
Right.
get better because they've been through it and now it's like, okay, like I'm done, like I just need yeah.
And they see the benefit.
Yeah, yeah.
It is interesting that it's actually an older population because even at my gynecologist office, I still see the same pain specialist, but most of the time I'm one of the younger people in the lobby, like waiting. And that's so it's interesting that people that are older now are coming back and being like, this was never addressed for me.
Right.
We need to take care of it, which makes me also sad that
Another thing I wanted to mention was that there is this, I don't know how to put it to words, but I guess a lot of men and women in regards to like pelvic floor symptoms, they always get brushed off.
yeah.
Like in terms of like going to a doctor and they're like, oh, it's like it's all in your head, or it's like, oh, it's not a big deal. It's old age, like you have to live through it. And so that makes it hard because then it's like they feel like they don't have like that's their life. That's gonna be their life for forever. Yeah.
And that makes me sad. That happens, unfortunately, a lot of conditions. Seniors in general get brushed off because everything's arthritis, or they're old, or they're this and that, and that's not the case.
Yeah.
And then other people, I think, and again, we can debate men and women and the things like that, but women get brushed off a lot about our symptoms. We could be hysterical, but like, it could be one of those things. But that's again why a lot of the things that what I'm trying to do with the podcast is teaching people how to fight for their healthcare.
Advocate.
Yeah, you have to be your own advocate because unfortunately also, and in a doctor's defense, they are surrounded, they probably have a zillion patients. They have 5 minutes to make a decision about what happens to you. And they're like, and that was even me to find the pain specialist that I had to go through like 4 different providers and a gazillion different treatments and all this drama for years until I finally had one lady who's like, try this guy. And it was just nice to go into a doctor and have him be like, I know what's wrong with you. I know what we need to do.
Yeah.
And I'm like, oh, thank God, because I thought I was crazy.
Yeah, right. It's nice to like once you meet that like healthcare provider who actually like listens to you and like validates your thoughts and feelings, like you gotta keep them and don't let them go.
Right. And that's also again the nice part is you get to have that one-on-one time in a private room with the patient so that they're protected and things like that to actually spend the time with a person. And so again, if you're having these symptoms, you need to keep pushing for it. And physical therapy, Arizona is a direct access state. So you can just pursue pelvic floor physical therapy on your own. Your insurance may require a doctor's whatever, and you can figure that out. But it's like look for these providers. So
there's not I would say there's not very many like pelvic floor physical therapists either. Like there is such a high demand for us. And there's just so much more patients that need to see us. And like sometimes like I have friends whose like schedule is like so booked and they have wait list and things. So yeah, if you can like just try to find somebody.
Right. So find Kimberly at more physical therapy, like she book out her stuff. But yeah, and that is also the other part is finding the resources, right? So you're already in pain, you've been blown off, you're like, maybe I'm crazy. and now you have to find a provider, but it
Right.
is worth it to
It
keep
is.
pursuing and getting in
Yeah.
there. And that was even for me, like, after all those years and all the drama, like it was just nice to actually have someone and
Yeah.
have a thing and the whole whatever from there. Um, I was trying to think from that, but so again, fighting to have your symptoms addressed.
Mhm.
Probably also, I'm assuming, just like other conditions, it's an up and down process.
It is, yeah.
So for pelvic floor patients, I'm assuming you probably get the same type of frustrations of like, why is this not instantly better?
Yeah. So I think a lot of people when they have like some sort of injury or like symptoms, like we all want that quick fix, right? But with pelvic floor physical therapy, it will be a work in progress. And that's, where the education becomes super important too. Is like at every visit, I always tell them like there will always be something new that you're gonna learn coming out of here today. Cause like there's so much I can only like say and like talk about like in that one session for the day, but like still and also like reaffirming them like we've even though you may not feel like it, we've actually have made some progress, so like being there to like remind them of those little wins that count too.
Right.
So yeah.
So it's interesting because again, I think people associate it very differently. So yes, you are dealing with a more vulnerable area, but like any type of physical therapy, our job is showing people where they've improved, right? Be like, you're doing great. Here's where you're doing. And then they have to do their stuff
Exactly.
or you're not successful.
Yep. Nope.
Right.
And then they wonder why they're not getting better. And I'm like, I always make it a point, like on their initial evaluation, like I can help you, but you also have to do your part too in order to see, good results. But we've all had like those patients that don't do their homework, and then they wonder why, like they're not getting better.
Right. And I'm like, I'm willing to fight for you 110%,
Exactly.
but you gotta come part of the way.
Yeah. It's an investment actually. Like once you like really invest in like each person's like and like their stories and all that stuff, and you come up with such a good plan to like help them, you just really have to like get them to see, like how can they do their part too and that.
Yeah, because I mean, for my patients, like I have the ones that are like, I don't know why I'm starting to feel better. And I'm like, are you more consistent with your homework? Yes. Or the ones that again, they're like, oh, therapy's working. I'm like, because you're working.
Yep.
And again, we'll take half the credit, but like with it. So it's similar lessons and therapy is generally you want it like this, right?
Yeah.
But it is this process.
It is.
Because there's still going to be flare-ups, depending on what type of condition, especially if it's been chronic, it's going to take a while.
Yep. Yep. And I always educate them there as well. Like depending on like endometriosis, for example, that's a lifelong condition. Like there's no cure for that. They will have flare-ups, but where do I come in, right? Is to help like reduce their pain, and like it's essentially pain modulation, right? In the event of like the flare-up, this is the things that you can do in order to kind of like tolerate it better so that we can have a more functioning life, quality of life. Essentially, with all things like physical therapy, you're trying to teach them the skill sets in order for them to kind of like wean off of therapy and be able to know like how can I tackle this in the event that this flare up occurs.
Right.
Yeah.
And I think that like people always expect it to be a cure. And there are some conditions you can teach a thing and you go and you're like, yay. But again, I feel like that's anything from like sciatica to like, hopefully like ankle sprain. But again, you've had an injury and you've had something happen to you. So the rest of your life is how do I manage this? Even if I'm 99% better, there's still a, even with my doctor, it was interesting. Not this one, but I had another one that like had failed to like educate me on actually what was going on. And I was like, why am I having this? And they're like, oh, well, it's become autoimmune. And now you have this, well, you'll have flare-ups. And I'm like, it would have been cool if someone would have said that to me.
First day.
Yeah, I was like, well, I wish someone would have said that. I would have been more understanding of like, why is this happening?
Yeah.
And so I was like, education is so important.
Yeah. We don't know, like a lot of people don't know like what's going on with their bodies, and it takes like, the healthcare providers, they've gone to school for a reason. And now it's like your job to kind of like tell them like this is why it's happening.
Yeah. So again, if you're being blown off, find a practitioner that does listen to you and does take the actual time to educate. For like, I guess for these type of patients, is there also like anything that they can expect when they go to PT? Like obviously like an internal exam if they are okay with it. Or is there anything that could better prepare them, or like I guess any other
Yeah, that's a good question. I always ask them, like, one of my first questions in meeting them on day one, like during the initial evaluation, is, do you know anything about pelvic floor physical therapy? So then some people would tell me, oh, like I did a little research, I kind of know, or like I would see like these reels on Instagram. But what I found to be most helpful was, so we have an awesome front desk, Jennifer, and she's so good with first-time patients, newcomers, because she will sit there on the phone and tell each and every one of them about the internal pelvic floor examination. And she will also send them our consent form detailing exactly what that is
so they have
before they come to see me. So then I don't have to do like a ton of work, but at least like they know what to expect coming in. And if they are coming in and they're like, I'm good, that's okay, right? And then if they move forward with it, then it's like there's no jump scares, right? There's nothing surprising, right? So I think that is most helpful.
To have that education in advance.
Yep.
So speaking of Instagram and all the things, so we always know if you see on Instagram or the internet, it's obviously real, right? It's all facts. So what are one of the big, I mean, aside from the fact that everybody has to do Kegels, what's one of like one or two or whatever the biggest myth that you see and you're like, like
biggest myth.
Yeah, I mean, there's sometimes like I'll see videos on the internet and patients will send me stuff and I'm like, I'll write back my like commentary, and sometimes sometimes they'll find fabulous things and I'm like, okay, that's and then other times I see stuff and I'm like, what is this madness?
So another myth. So in the pelvic floor world, we do have like other tools. They're kind of like tools in our toolbox, right? Kind of to supplement your treatment of care, whatever. So I've had a couple of patients in the past who would buy like Kegel weights or like vaginal weights, pelvic wands or dilators, and thinking that without seeing a pelvic floor physical therapist first, thinking that that will solve their issue. But this one patient, specifically, she came in with a very hypertonic pelvic floor or overworking pelvic floor.
So she was just making it
and she bought Kegel weights. And Kegel weights are there to strengthen the pelvic floor. It's the kind of the similar concept for Kegels. And it was just making her problem worse. And I was like, what?
And then you have to be the person that's like, no, you don't need the little like ball things that you squeeze. And you'll see that advertised a lot. Like I think they have like the egg thing or something, and it's the biofeedback. And those are good options if
appropriate, yes.
However, just like all things, right? Like I guess again, I know we get it where the patients are like, oh, I just went on YouTube and I looked up a rehab program for my shoulders. I've been doing this, or like we're working really hard and someone's gone and then like I just saw this thing on Instagram, so I tried it instead, and I'm like, crap, And so same thing with pelvic floor. It's just like anything else. You probably want to see the actual expert first before and that's probably also like I'm sure you see a lot of that where women have tried things like I've done Kegels of like this and that, I've done this and that, and so they bought all the I don't know how they take it when you have to tell them they don't need the expensive things they purchased, but
I haven't had like any like super aggressive, like, they were just like, oh, okay.
And I guess I assume that's probably a fairly common like thing everyone assumes. And that's like everyone assumes I need to go to pelvic floor, I need to be doing my Kegels.
It's hard. Like I love social media for like, spreading more information, regarding whatever topic. But one of my pet peeves is like one of those let's say like a fitness influencer or whatever are like showing you a specific exercise or whatever to like help relieve back pain.
Uh-huh.
Like just that one exercise, if you do it like 10 times.
Yes, and everyone's like, "Oh, I saw this thing."
No.
Uh-huh. Yeah, and that's the thing. It's like I like putting stuff out there for like education for people, right? I'm like,
Yeah.
here's an exercise, but I always have to put the disclaimer,
Yeah.
like,
Yeah. At least put that, and
like,
then I would feel a little bit better.
yeah, like I like this exercise, but obviously call your physical therapist
Yes.
and have
Yeah.
them like go over this with you.
Yes.
You can try this for whatever, however,
Right.
like
Right. Yeah.
call me first or
Exactly.
whatever.
Exactly. Yeah.
So, but yeah, I do see that as like influencers or even PT influencers too.
Yeah.
And it's not picking on like I
No.
appreciate their amazing content, but
Yeah.
patients have to realize that just because someone's like, here's the 3 things to fix
Yes.
your jaw problem
Right.
or whatever,
No.
it doesn't apply to everybody.
No.
And you could be actually harming yourself if you don't
Yeah.
actually see a PT first.
Exactly. Yeah.
So
I agree.
that's why I do get a lot of patients will fire over something, which I would rather have them look at something and then in the back of their mind be like, would Tracy say this is okay?
Yeah.
Send it to me. And then I'll be
Okay.
like,
There you go.
yeah. So same concept.
Yeah.
Like, do I need this? Like
Yeah.
fire it over
Mhm.
and then yay or nay.
Yeah. Yeah. And then we tell them why.
Yeah,
Right?
then
Yeah.
that's your education moment
you
of
go.
like, this isn't appropriate for you
Nope.
because of blah, 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 you know. Because I even had a patient recently, they just bought a book of like all these exercises they want to do.
Mhm.
And I was like, give me that. Because I'm like, there's a bunch of things you could do and they're gonna harm yourself. And then you're gonna undo all of my work.
Yeah.
And then you're gonna be mad that PT didn't work.
Yeah. Yeah.
And so I was like, give me that
Right.
book.
Exactly.
So I'm trying to just think even on there, like, yeah, there are all those devices. Do you use the biofeedback in your stuff or
I've only really used
Mhm.
it like once when I was at doing my clinical
Mhm.
rotation. We don't have any of those biofeedback machines here at
Okay.
our clinic. Just because I guess we haven't felt the need
Right.
for it. If anything, um for the patients who are a
Mhm.
candidate for like the internal pelvic floor treatment, right?
Uh-huh.
That's where that involves hands-on therapy from me
Uh-huh.
internally. I guess in that perspective, I would be the biofeedback then.
Right.
But so far, I mean, I think it's super helpful, especially for people who have a very weak pelvic floor and they can't even isolate the pelvic floor to do Kegels, right? So like
Right.
we grade the pelvic floor contractions
Mhm.
as a muscle manual grade.
Right.
And so on a scale of 0 to 5, typically I've seen a lot of people who are at a 1, right? So
Okay.
that would be like a trace contraction, but
Right.
it's barely there.
Okay.
And so I think having a biofeedback for
Mhm.
them specifically would be very helpful.
So that they could know what that feels
Right.
like.
But I've
Mhm.
had some people who didn't even need they started off as a 1 and now
Uh-huh.
they're a 4,
Oh, nice.
even
Okay.
without a biofeedback. So
Right.
it's really individual.
Mhm.
Yeah.
Okay.
Mhm.
And I have also seen a little bit on your things where there's a lot of like breath work focus.
Yes.
So talk a little bit about that.
Yeah. So breathing is probably like our bread and butter in the pelvic floor world. And it's
Mhm.
one of those things where like a lot of people underestimate like the benefits that it can give us, right? So I think for one quick example, a lot of postpartum moms, so
Uh-huh.
like they're so quick to like get into that, snatched body ways after delivering a baby, and then they
Mhm.
wonder why they're not making a lot of progress there because they started off like 6 weeks after delivery. Now they're trying to do sit-ups, right? So
Uh-huh. I'm sorry. Everybody tries to do sit-ups for core, and then I'm like, what?
I know, right? So I would say like one, if
Mhm.
anybody who sees a pelvic floor therapist, if there's one thing that they've learned, it's
Mhm.
learning how to do 360 breathing is what we call
Mhm.
it.
Mhm.
Plus transversus abdominis contraction, or
Mhm.
essentially core bracing.
Mhm.
So I can walk you through that too if you're interested.
Yes. I
Okay.
mean, even if I want to just give like a little preview of
Yeah.
it.
Yeah. So like so I normally have them kind of like laying on their backs and like
Mhm.
with both knees bent. And I ask them first, like, what does deep breathing mean to you? Because
Mhm.
then that from observation can tell me a lot. Some
Uh,
people, like for women, they tend to like breathe up here and they try to suck it in type of thing.
Instead
Because
of
like
belly breathing.
yeah, and like all their lives, like they're told like to kind of suck
Women have
everything
to suck our
in.
abs in. We have to walk around in the like
Right?
skinny jeans.
Yeah. And so when by doing that, like over the years, obviously like they're not breathing most optimally,
They're
right?
not actually using their diaphragm fully.
Exactly. And so I normally will tell them, use this analogy that imagine your torso like a soda can. So you want to make sure that I usually have like one hand on the chest, one hand on the belly. When you're inhaling through the nose, making sure like both the chest and the belly are expanding at the same time. And then I'll move to the sides of your ribs, making sure the ribs are expanding as well. And then obviously our backs, they make up the back of the soda can. So making sure we have that 360 breathing.
Okay.
And then after that, teaching them how to activate their transverse abdominis muscle, because that's the muscle that runs around the trunk like a corset, right? Being able to activate that muscle, which is your deeper core muscles, and then being able to like coordinate that with your breathing is how you can brace your core a little bit better the right way. Like that's like literally the most basic foundational exercise anyone can learn before we can like tackle on like the ab separation that a lot of moms are complaining about.
Right.
And so other benefits to breathing and core bracing, right? So that specifically I like for to give to people who have stress urinary incontinence because they're managing their intra-abdominal pressure incorrectly, right? So if you take a big inhale and you hold it, then you would feel that pressure that gets built up inside. But then what happens is like that pressure gets pushed down on the pelvic floor and the bladder, and so that's why they have leakage, right? So teaching about how to breathe correctly or most optimally, core bracing, teaches them how to manage their core pressure better. And so that way they won't have any leakage. Because like you can have leakage just by sitting up or sitting down or like stepping up off and on a curve type of thing and experience leakage there. And you will always create intra-abdominal pressure. So now it's just teaching them how to better manage it. Another reason why I like breathing. So if we inhale through the nose, the both the diaphragm and the pelvic floor, they shift downwards, right, to allow for air to come in. The pelvic floor at this time is actually relaxing, right? And then when we exhale and breathe out through our mouth, then both our diaphragm and our pelvic floor are shifting upwards to push all the air out, right? But now the pelvic floor muscles are contracting. So that goes back into getting that, can the pelvic floor have the ability to go through that full range of motion type of thing? So people who have pelvic pain during intimacy, it helps with that as well because it taps into the parasympathetic nervous system, right? It helps you to rest and digest, to calm down the nervous system essentially. So there's like so many benefits, but a lot of people underestimate breathing and core bracing. So yeah.
I feel like, well, two things. One, I love that it's a soda can analogy.
Yeah.
And two, I feel like breath work in general gets ignored with so many things. So that's why I think it's very important. Like a lot of times it's good when you do it with yoga.
Yeah.
I see that a lot in like restorative things or just even working your exercises. And then those are lessons that can be applied not only just pelvic floor, which I think is really important, but also back pain.
Powerlifters,
Yes.
CrossFitters.
Yeah, and you also saw like kind of the soda can analogy with things where it's like where it can hold when it was like solid like that, or if you didn't like how crunch the can or whatever as you're doing it. But yeah, so that applies to so many things.
Yeah.
But it also is interesting that for pelvic floor, people are like, oh, this just happens, and they never even think about how they have to learn how to modulate that pressure. And also, I love transverse abdominis work. I just feel like everyone's so worried about having the pretty ab
The
muscles.
6-pack or 8-pack muscle.
Yeah.
Like those are just superficial and they're not the ones that we care about.
Yeah, and so that I'm always harping on like that stuff. I'm like, and transverse abdominis is like a big muscle if you can get it to work. But most of the time it's just hanging out like
it's so
waiting for some love.
it's neglected sometimes.
Yeah, and that's kind of, it was interesting because I had one guy who was really upset with me. Like I just kind of from filling in, and he's like, I do all this work, and I'm like, and of course they had not been doing any of the bracing work, right? And none of the stuff. And I'm like, the one exercise that would have saved you. So now you've just done a bunch of things where you're using all the wrong muscles and you're hurting yourself. So, but I do really love that with the breath work with it and realizing how much it affects. Because I think people don't even realize that they have to work on their like core control.
Yeah.
And also to breathe. And sometimes it's hard to just stop and breathe.
Yeah, and plus, like, especially when people are stressed, so like they tend to hold a lot of tension in their shoulders and they're not breathing a lot, or like they hold tension in the pelvic floor. Same thing. So it's when they're stressed, it's like that's the last thing they care.
Yeah, and then you're like this, and also you've got someone in pain, we're freaking out, and you're like, I need you to breathe.
Yeah.
So, which is kind of sometimes why I like when you have to go to classes or it's an instructional. And I'm kind of the person who runs around all, and to have to take those times to just be like, okay, it's time to focus.
Yeah, just like I think with everyone nowadays, like we all seem to be rushing to places, doing things constantly, like without giving ourselves some break. Like if you can, like once in a while, just like stop and pause what you're doing, just like check in with yourself, like, are you okay?
Right.
Just like do a couple of breathing and then like you can move on to your next task or whatever.
Right. So even if none of your one of your exercises, take your minute to breathe.
Yeah, exactly. That's literally
And imagine how much that takes away from that stress. It helps you re-regulate where you're supposed to be. So
yeah, I think what would be most beneficial or motivational for people to do any kind of exercise or to like attend pelvic floor therapy, any kind of therapy, is like to see it, to change your mindset a little bit and to think of it as an investment in yourself. It's like you probably haven't, which is probably why you're here. So now it's like just kind of slow down and like just check in.
No, and that's good because I think that's probably also something you have to probably battle, right? You get someone and you're like, let me teach you how to breathe. And they're like,
Yeah.
what? I'm here for this.
I know. Yeah.
And you're like, and maybe even just explaining that, like you're changing the way the pressure is inside of your body.
Yep.
This pressure affects this muscle. And if you don't teach it how to do its thing, then you're just going to be running around with this problem.
Yep.
So yeah, I know I always keep relating it back to regular PT, but I feel like a lot of our job is teaching people like, here's what's happened to your body. Now it's time to invest in your healthcare for the rest of your life.
Exactly. Yeah.
So, but yeah, that's a good message of like take a moment to breathe because it'll make the rest of your day.
Like honestly a huge difference. Yeah.
So, trying to think. I feel like I've annoyed you with many, many questions, but but I also just like breaking the stigma of like pelvic floor therapy because I feel like for a while, like when I was in school, like there was one lady who came and she specialized in vestibular issues and pelvic floor. So that was really interesting. Like she had the specialized clinic, but because she didn't have enough of each clientele, so she specialized in both areas.
Oh, I see.
But now I feel like she would probably just be overwhelmed with pelvic floor. So I feel like it is growing and hopefully there's education in that. But I think it's good to start breaking that down and letting people know they don't have to live like this.
Yeah.
So, is there any final things you'd like anyone to know, besides breathing? But like,
I think just going back to what I said earlier, if you're not sure if you're a candidate for pelvic floor physical therapy, just come in and ask all the questions.
Right.
And then it's because like I'm not here to like chain you to the clinic. Like you have to keep coming here. And it's really up to them and for them to like kind of decide like do they want to take a minute? Is this a good time to like invest in themselves? Right. Do I still see the benefit in this type of thing? So still go see someone.
Yeah. So if you're having issues, there's nothing wrong with just doing an informational session, right? Like even my patients that have to go to orthopedics or whatever, I'm always like, there's nothing wrong with checking something out and gathering information.
Right. And like plus with our clinic, like we have a free 15-minute consult even then.
Yay.
Right?
Right.
So, and that doesn't cost anything.
Yeah.
So
Yeah, and that's perfect. Then they could ask other questions, see if you're so free 15-minute consult, even better. Yeah, because again, I think sometimes that's the hardest part because I think people are afraid if they make this appointment, if they go in, they're stuck, right? I've committed, and unfortunately, as bad as it sounds, there are clinics that trick people in and they sign you up for your 3 times a week for a 12-week plan or whatever. So that's not the case here. Find a good practitioner, obviously someone like Kimberly who will get in and spend that education with you to answer your questions. So, so get your stuff checked out. It's okay to ask questions. See her at more physical therapy. If you find random myths on the internet, bring those in as your questions, or not even myths, just if you find random videos, always fire them over to your physical therapist before you attempt them. And then I think that's all I was going to bug you with, but I just appreciate you spending the time and that someone like you is in that area because as a regular PT, and again, also just, I love watching her videos from Doc G's videos online where she talks about how important it is to actually talk to someone who specializes and how much we appreciate that other people specialize and things like that.
I was gonna say, earlier when we were talking about like pregnant women working out, such a huge myth,
Right?
Right, and all the more reason to like go see a pelvic floor therapist. Like, am I okay? Because like coming from somebody who would like have loved lifting all their lives, and now they have a baby like on the way, like we don't want them to like stop. Obviously, like there's certain things that we would advise them to not do, but like still like being able to continue with exercising any kind of form would actually help with the delivery, and then so that way you're not so far off from your baseline after delivery, if that makes sense.
Yeah, and so sometimes I think women don't realize that they can see a pelvic floor therapist before they have their baby. They think it has to be something they deal with after as part of the aftermath. And it's probably better to get all that stuff educated and then know that there's that connection when they're done with the delivery.
I've had some people who would come in just for like a checkup, like full body, just want to make sure that they are better prepared to have the baby, right? And then we still see them during pregnancy actually too.
Perfect.
And then after as well. So
and that's part of it. I mean, it's just like you have like you're seeing the OBGYN for all that stuff anyway, you might as well be working with someone to prevent issues for your pelvic floor along the way as well. I'm sure you get a lot of like the diastases rectis and the things like that after. So
but during pregnancy, a lot of women have back pain, for example.
And I mean, even from the regular PT side of it, I've definitely worked with women prior because they do want to, I think women want to stay active, but they are battling under these myths. And again, with kind of what she said, the doctors have to be a little more conservative to protect themselves. But it's good to have where they like working with someone who knows, like, it's okay. Let's keep you exercising. This will help with your delivery. So so see the pelvic floor therapist for all the things. But I mean, even just like pre-planning, right? Like I'd rather have a patient come to me preventatively. Not that I don't want to be there for you to get hurt, but like if you prevent, then we get you going along and like
I guess especially a lot of people who are new to fitness and they want to get some sort of guidance. For example.
Right. So that's perfect. So I love that with that. And I appreciate that she was like promoting that online as part of her own journey, you know, because she wants to stay lifting. So well, there will be continue. We'll do more educations, all the things, free 15-minute consults if you need, just to at least get your questions going. And thank you again for taking the time with me today.
Thanks for having me.
Thank you for tuning in for today's episode. As always, we hope that you found some nugget of information with all of the stories that these guests have to share. And always feel free to follow Better Fit Therapy online on all of the social medias, Facebooks and Instagrams and all the fun things. Feel free to message at any point as well if you have a condition or you have a topic that you would like to explore. Feel free to send that in. Also, if you would like access to any of the resources or things from a different episode, please always feel free to send in a message and we can direct you. And again, thank you for taking the time, and don't forget to fight for your healthcare.